I'm Brittany Lewis with Forbes Breaking News. The House Oversight Committee held a hearing Monday on the federal response to the opioid crisis. During the hearing, Congressman Stephen Lynch expressed dismay in the current administration's federal drug response. Lynch claimed, quote, "We seem to have gone from a policy where we try to get people clean and sober to a policy where we now try to get them off one drug and on another drug." The Massachusetts Democrat offered that there should be a focus on behavioral health instead. Take a listen to his explanation.
Recognize Representative Lynch.
Thank you, Madam Chair. And Dr. Gupta, thank you for joining us and thank you for all your good work. I've been at this a while and we have had a difficult time in addressing the drug problem in this country. We seem to have gone from a policy where we try to get people clean and sober to a policy where we now try to get them off one drug and put them on another drug. And I'm speaking specifically about Suboxone and how we've taken the lid off and allowed doctors to have hundreds of patients and just give them Suboxone and not really deliver any behavioral health services that would get at the underlying addictive activity. And those individuals, and I'm seeing it in my district where we've got a couple of clinics that hand out Suboxone. The patients go out the door and then they either trade that or they buy fentanyl or methamphetamines, which is even a worse problem. They can't get high with the Suboxone, so they're going to harder drugs, and we're actually seeing much more violent activity because an individual on methamphetamines might be up for days, and we're seeing a lot of stabbings, a lot of violence. And I'm just questioning the whole policy here, where we seem to be moving away from getting people straight, getting them clean, getting them sober, getting them back into their lives, and instead we're getting them on different drugs. And I just don't see a good result as a result of that policy. You got any thoughts on that?
Thank you, Congressman. One of the things we realized in the last few decades is this is a brain disease. It's just like a lot of other diseases, a brain disease. And the way we need to treat that is as a disease of the brain. That includes making sure that we understand the disease better. We provide the FDA-approved medications to help the person. And people may have different ways of getting at the treatment, Congressman. Some people may actually do okay cold turkey. Others may actually need the medication for varying amounts of time. But one thing that I've in my 25 years learned is we've got to figure out how to get the help to people when they need it and where they need it, because they may not be coming back. The next time they come back would be as a fatal overdose in my emergency room. And that's why we've taken effects and actions here to save lives first. And part of that means that get people the help they need, figure out what works for them, while not giving up on our research agenda, making sure that we are
I appreciate that, Doctor, I really do. But I'm just telling you, I'm trying to give you a little feedback. It's not working where I am. It's not working in the 8th Congressional District of Massachusetts. I got 10 cities. I got hundreds and hundreds and hundreds of people all together right next to the Suboxone clinic, right next to the methadone clinic that are shooting up. And, they're shooting up 5 or 6 times a day. And, it's just a very bad situation. I've had to go down there and look for young people who have left their families and are now totally off the grid and addicted to these, to fentanyl and methamphetamines. And it's a sad state. The Journal of Medicine just came out with an article 2 weeks ago, that in 1 year, between 2019 to 2020, the adolescent death rate has gone up 100%. It doubled in 1 year. And I just think that we're pushing more of this stuff out. It's not helping. So I think we've got to reassess. One last question. I'm also on the Transportation Committee, and I had an unclassified briefing with the Department of Homeland Security and FAA. And they tell me that, and this is on Judicial Watch as well, we had 9,000 unauthorized drone incursions over the southwest border last year, 9,000. And I'm just wondering, you know, these drones have a payload of anywhere from 3 to 5 to 8 pounds. And I'm sure a lot of fentanyl is coming in over the border by drone, not by individuals, but by drones. They're shipping it in. And I'm just wondering, I know the number of interdictions has increased, but I'm just worried about volume. Is that because there's more volume coming over? You have any thoughts on that?
Thank you,
Fired,
Congressman.
but the doctor may answer your question.
Thank you. On the first part, I would say it is tragic, Congressman, and we're willing to work with you and Congress in any way possible we can help Americans. Too many dying, unacceptable. On the second part, that's exactly the challenge today. The 21st century tools and technology that we need to be deterrent to these air drone, marine drones, subterranean tunnels, some of which I've been inside of. We're going to need to work collectively to have deterrence technologies of the future, because our adversaries are not waiting on us to develop them to fight this. And so I would look forward to working with Congress on some of those aspects, which the bad guys figure out one way or the other to bring drugs in.
I look forward to working with you as well. Thank you, Madam Chair. I yield back.